We also inherited a failed health care law that threatens our medical system with absolute and total catastrophe. We're going to repeal and replace Obamacare.
And the crowd at CPAC liked that. President Trump not backing down when it comes to overhauling Obamacare, but a new report is sounding the alarm, claiming millions will lose their coverage if it is replaced. But what would happen if we kept the current law in place? Let's talk a little bit about that with Dr. Nicole Saphier.
Good to have you here this morning, Doctor.
Good morning, guys.
All right, so let's talk about the other side of this argument, because, you know, I've talked to small business owners around this country throughout this campaign. I cannot tell you how heartbreaking it has been to hear about people who have, many of them lost their whole business because of Obamacare. So there is another voice in this conversation. What happens if we keep the law in place?
You know, I've said several times before, the impetus, the motivation behind the Affordable Care Act, you know, is good. We want to try and cover as many Americans as possible. However, this model has proven unsustainable. If we were to go on as business as usual, we're going to find by end of 2018, we're not going to have hardly any insurances in the marketplace, which is going to have even less options for our patients. And premiums and deductibles are going to continue to go up. Right. And the piece that everyone's missing is health care costs have risen more in the last couple of years under the Affordable Care Act, while we have more insured patients, than it has in the last 30 years. And that's because the behind-the-door, burdensome by the administration effects of the Affordable Care Act.
Okay, and in fact, Donald Trump himself said, you know, I tell Republicans, let's not even touch it for 2 years, it'll crater, and then people will realize that it was just a piece of garbage. But going forward, the Republicans say they're going to repeal and replace it, and that's political peril if they wind up with something not, you know, not on par or less than or better than would be great, but we don't know what's going to be in it because they haven't announced it.
The system is failing. We're on a one-way track right now to a complete collapse of our healthcare system. So it is going to fail. Whether it's tomorrow or in 2 years, it's going to fail. So we need to start coming up with some things. Right now, healthcare providers, we are completely swamped with documentation, compliance, limited time to see our patients. We're working more. We're getting paid less. The quality of care is actually going down. This was a weak attempt to have socialized medicine, and for our country that is so large and so culturally and economically diverse, it's not going to work. So we need something else.
Yeah, they've got a challenge on their hands, and they've got to get it right.
Yep.
You know, I think everyone's waiting for that. Dr. Saphier, good to have you here this morning.
Thank you.
Breaking the other side down that we don't hear enough. All right.
I've got a feeling we're going to hear more about it tomorrow night when the president talks before the joint session of Congress.